Hello, welcome to Recovery Coaching Services of New York. I'm Lucius Conway, Certified Recovery Peer Advocate and Manager Member of Recovery Coaching Services of New York, the first and currently the only substance use disorder peer-run for-profit organization actually authorized to bill Medicaid directly for peer support and bridger services. That's right, we're making inroads in the industry in terms of being able to help others get back control of their lives and live their most productive and highest quality of life. How do we do that today? We enroll in FIDA here in New York State. It's a part of a pilot program between the federal government and New York State for those who have Medicare and Medicaid. I'm going to explain to you how to enroll today. It can be kind of confusing. Some people in New York State received mailings recently in the last couple of months regarding the enrollment process, and it's been kind of muddy. So we're going to try to make it a little clearer for you today with regard to how specifically you can qualify to receive Medicaid and Medicare covered peer support and bridger services from me, from Recovery Coaching Service of New York. And here's how. The first thing you have to understand is the company that provides the service that we're contracted to is called Centers Plan for Healthy Living. That's the company name, but that's not what you're going to really need to know. What you really need to know is the plan name, because that's what they're going to ask you when you want to enroll. The name of the plan is FIDA Care Complete. And we're going to see how simple that enrollment process is today. But let me just share with you some information from the internet, where the information may be found most readily at the website of Centers Plan for Healthy Living. It's the FIDA Care Complete Medicare Medicaid plan. I'm hoping you can see that clearly enough, and I will read some things for you. I don't assume any longer that everybody English is your first language, or you understand a whole lot of the unfortunate gobbledygook that sometimes plagues and fills the pages of what we need to know in order to get the services that we need to get. This is a Centers Plan for Healthy Living FIDA Care Complete Medicare Medicaid plan. What does FIDA stand for? Well, FIDA stands for Fully Integrated Dual Advantage. What is FIDA? FIDA is a demonstration program that introduces a model of care which integrates and coordinates participant benefits and care across the Medicare and Medicaid programs. And then for more information, it tells you to contact New York State Department of Health, who has also created a website that will be coming online to provide participants with more information about the FIDA program. I'm going to give you some general information that will be helpful, but in order for you to actually, again, utilize the services of RCS's peer support and bridger services, you have to be enrolled in a FIDA program, but specifically the one that I'm subcontracted to on the behavioral health end of things is the Centers Plan for Healthy Living's FIDA Care Complete plan. So it's the FIDA Care Complete plan, and hopefully we'll be able to make a call and show you how simple that enrollment process is. Now, I know that I do not qualify, but I want to make the call anyway because I do receive both Medicaid and Medicare. Yeah, I'm disabled, but I'm working on creating some ability within me to get back into the workforce in full force, doing what I know how to do. And I'm hoping to be able to help you optimize your life in the same way, live your best life. So here we go back. So now, it's a demonstration model program for people who receive Medicare and Medicaid, who qualify for both of those programs, to bring them together more or less under one umbrella with somebody, a care coordinator. Sometimes, in some instances, that care coordinator will be me or a representative from the company, from your FIDA Care Plan company, which is Complete Centers Plan for Healthy Living. That care coordinator is there to help you navigate through services and keep everything, where you can get it. What is FIDA Care Complete? This is the plan that I provide behavioral health services, peer support services under. FIDA Care Complete Medicare Medicaid plan is a managed care plan that contracts with both Medicare and the New York State Department of Health, which is Medicaid, to provide benefits of both programs to participants through the fully integrated dual advantage demonstration. That means whatever you qualify for under Medicaid and under Medicare is provided under this one umbrella. So you don't have to go over here for the Medicaid program or over there for the Medicare program. Your care coordinator will bring it all together in one FIDA demonstration program. What is FIDA Care Complete service area? Well, FIDA Care Complete serves New York City's 5 boroughs, and that's where I serve. I will be available to work with people throughout New York City's 5 boroughs. So if you live in Manhattan, if you live in the Bronx, Kings County, Queens, or Richmond even, that's Staten Island, you can receive services from Recovery Coaching Service of New York's Peer Support and Bridger Services. Who's eligible for FIDA Care Complete? Residents of those 5 counties, as well as you have to be 21 years old or older when you enroll, and who's entitled to benefits under the Medicare Part A and enrolled under Medicare Parts B and D and receiving full Medicaid benefits. So this is another criteria for enrollment. You're getting Medicare Parts A, B, D, that kind of thing. Who also meet one of the following requirements. Meets one of these following requirements. And this is where I don't qualify, but this is where perhaps you will. So, one of these following requirements. A nursing facility clinically eligible individual who is receiving facility-based long-term supports. So if you're in a nursing facility receiving long-term care, which means that there is no anticipation of you leaving that nursing home, I think the construct is within 120 days or so, that's considered long-term care, you would qualify for services. An individual who's eligible for nursing home transition and diversion, an individual who requires community-based long-term care services for more than 120 days as determined by a state-approved clinical assessment. Now that last piece is the piece that I'm most curious about, individuals who require community-based long-term care services for more than 120 days, which makes me think if you're getting Medicare and Medicaid and you're in a treatment program that's at least 120 days in length, and that's too much. So if you're in a 3-month SUD program, substance use disorder program, rehab, if you're in a 6-month program, a 3-month program, a 1-year substance use disorder program, you qualify for Medicaid and Medicare, then and you're at least 21 years of age, and you're entitled to benefits under Medicare Parts A, B, D, as well, then my guess is that you will qualify for services under the FIDA Care Complete plan, and thus the Behavioral Health Services of Recovery Coaching Service of New York as peer bridger, peer support services provider in the plan. How do I find out more about FIDA Care Complete? Well, the way you find out more is, let's take you back in so you can see what I'm reading here. Okay, how do you find out more? There's a summary of benefits on that website you can look at, and that'll tell you more. There's a handbook from FIDA Care Complete, which is the plan that I'm subcontracted to. And for a complete list of FIDA Care Complete's coverage services, you'll look at that and find that in your participant handbook once you enroll in the program. How do I find out if my drugs are covered? There's going to be a list of, there is a list of covered drugs on this website, and they're creating a drug lookup tool for that purpose as well. Now remember, all of these questions can better, I think, more easily be answered if you're talking to a live human being at the plan. So you can always contact the plan, go to the website, get the phone number, and call the plan, and you can ask them questions directly. And I think that that's the shortest path to the answers that you want to know. The website for me informs you of some questions that I might not think of that you might not think of. So I would think of going to the website in order to kind of gather my questions and see if there are answers there that actually address the question. But if there are not, then I would call and talk to a live human being. And I'm one of those kind of people. I like live people that I can interact with, because sometimes I don't get the gist of something that's written, that I've read, and other times I can't convey what I want to convey, you know, by typing in or emailing. It's easier for me to have a conversation with somebody. So anyway, it talks about what drugs are covered. How do I find out if my doctor, facility, or pharmacy is in the FIDA Care Completes Provider Network? Now remember, I'm in FIDA Care Completes Provider Network. I'm part of the Behavioral Health Provider Network, subcontracted. So I provide a piece of the behavioral health program, which is the person-centered recovery plan development and creation, development, and maintenance. So my role is to help someone in the FIDA program, who's in a FIDA program, for example, in the FIDA Care Complete plan, if you're qualified, and I would come in to help you put together your quote-unquote recovery plan, or for me, I like to call it a wellness plan, which is a plan of action to look at the 7 dimensions of wellness in your life and what you intend to do and how you might do it to improve the quality of your life, to make your dreams come true. I mean, I start every one of my sessions with the question, what does your dream life look like? At 50 years old, I began to pursue my dream again of singing jazz. And I am very, very happy to say on the eve, as it were, of my 52nd birthday, I perform regularly here in Harlem at some of the most notable jazz venues with my own band in white tie and tails, and I'm having a great time. People are well receiving me, and I'm looking forward to perhaps sometime this summer cutting my first album. So dreams do still come true, and somebody said, you know, it's 50 years of learning, and then after that 50 years of living. So if you're 50, then you're just beginning to live. And so, and if you're under, it's time to learn some more tricks, and maybe you start living sooner. So anyway, so you go back and we find, how do I find out from my doctor? So not all doctors are currently in everybody's provider network. You find out if the doctor you're currently seeing is, if you can continue to see that doctor until you find a doctor that works for you, that is in network. And those are things, again, that you would discuss with your FIDA Care Complete care coordinator. And that's a person that's there, and their job is to help make sure that you get the quality of services and type of services that you're looking for. I want to say that it is a very, very important note that FIDA is about person-centered treatment. It's a new strategy that the federal government has found is scientifically viable. If the services that you receive are tailored to what you want, then you're more likely to adhere to the service regimens, to be compliant with taking medication on time, seeing your doctor on time, exercising responsibility over preventive health care so that you don't get sick and find yourself in crisis. My job as a recovery coach or a certified recovery peer advocate is the state title that I use. My job in that capacity is to help you kind of stay on course, not as an advisor, but as a friend, as a companion, to help you along your way in the same way that I help myself daily. Remember now, I'm the author of this book, My Daily Alcoholic and Addict Prayer, Prevention, Recovery, and Help Ritual, as well as my daily recovery ritual. So I'm about wellness and recovery, and yeah, I was a substance user, and I was addicted, and a whole lot of other stuff. But through my own cognitive behavioral therapeutic values that I found worked for me, and the tools that I have that will help you by creating a recovery plan and a weekly contingency management plan, I'm pretty sure you can get your life on track, and you can actually achieve whatever your dream is. I don't think that there's anything impossible. I really don't believe there's anything impossible for any of us. I don't think that there's a dream that's too big. I don't think that there's any such thing as that, and I'd like to be able to prove that to you. But you've got to enroll in FIDA if you qualify. We'll talk about something, another program that will be coming open in April, but we'll speak with that in other recordings, other webcasts. So anyway, you find out if your doctor's in network or your pharmacy, your dentist, that kind of thing. If not, can they get in network, or which ones are there? Is there anyone that you can work with or are interested in working with? Who do I call if I have questions about FIDA Care Complete? You'll call FIDA Care Complete. See, I told you you can call FIDA Care Complete. And so I'm going to make sure I'm going to put this number on the screen when I post this. So let me write it down so that I can remember to put the FIDA Care Complete number up on the screen, so you won't have to like worry about going back to the website if that's not what you want to do. I believe in making things as easy and accessible, at least at the outset, as possible, because health maintenance, like car maintenance or anything else that has to be like taken care of, that's very sensitive, sometimes can be very challenging. If I'm not feeling well or I'm trying to get my life together, the last thing I want to do is be trying to dig through stuff and research stuff, because I'm in perhaps an anxious state. And so when we talk about our health and our health care, that sometimes puts us in an anxious frame of mind, and we're not clear enough or calm enough to actually approach this in a logical, rational way. And so what I like to do is try to make it as accessible as possible, so the process is as easy and seamless as possible, and you constantly are engaged with an individual who is sensitive and compassionate to you, and understanding that this may not be the easiest thing that you've ever done in your life, and to try to help you understand that their job, like mine, is to help make this process easy for you. So I'm going to put the FIDA Care Complete number on top of this webcast. It is 1-800-466-2745. Okay, and it's open 7 days a week from 8 to 8. So 8 a.m. to 8 p.m. Monday through Sunday, you can call FIDA Care Complete. And remember, that's the plan that I'm a provider on. Recovery Coaching Services provides a behavioral health service, the peer support and bridger service, through FIDA Care Complete for those members enrolled in FIDA Care Complete. And that's the Medicare Medicaid plan. So we'll give you that phone number. And you can also call New York Medicaid Choice, which is, and New York Medicaid Choice is how we enroll. So we're going to call that number, and we're going to see what happens. But first, let's see, the number is 855-600-FIDA. And letters instead of numbers generally challenge me. If you're going to give me the numbers, the letters, then give me the numbers, then give me the numbers too. But I'm going to make life easier for me at this point, and perhaps even for you, by finding out what those FIDA letters are. I don't know my phone dial well enough to know what those letters would be. So FIDA is going to be, F is 3, I is 4, D is 3, and A is 2. So it's 1-855-600-3432. Okay? That's what that is. Now, let's go back to the website. We're going to the phone in just a second and start a conversation. I'm going to put the person on speakerphone so that you can hear what's going on. I'm not going to tell them that you're here, because then that may make them do something different. I want you to see how organically the process works, and how smooth and simple it is organically, and so that nobody's putting on the show. This is just how it works. So it goes on to say, if you have questions, you can call FIDA Care Complete, which is the plan, 7 days a week, from 8 to 8, or you can call New York Medicaid Choice Monday through Friday from 8:30 a.m. to 8 p.m. So they're Monday through Friday, 8:30 a.m. to 8 p.m. So we have plenty of time to get a call in to them tonight. And you can also visit the website, and it has the website address there. Of course, as I've explained to you, I'm not that prone to do that kind of thing. If you give me a phone number, I'm more likely to dial the phone number and see if I can talk to a human being. The Medicaid Choice Counselors, New York Medicaid Choice Counselors, they'll help you understand your rights. They'll help you understand your FIDA plan choices, which is how many FIDA plans are there. As I've indicated to you, I'm only under contract with one of them, and that's FIDA Care Complete. Now, there are other FIDA plans, but as to my knowledge, they do not have peer support bridger programs online. So they don't have certified recovery peer advocates, such as myself, as a provider in their network. So I don't know how they approach the idea of you creating your recovery plan, being self-directed, which is a part of the federal mandate. I don't know how they address that. One of the things that I'm being told is that I will be approached by more FIDA plans to contract with them or subcontract with them as their peer support bridger provider. And I'm perfectly and totally willing and ready to do that. Fortunately for me, I know most of at the last count, 50 certified recovery peer advocates in the state of New York who are ready and willing to go to work and help others regain control of their lives and live their best life. And in most, if not all cases, make your life dream come true. So that's the state of affairs. Anyway, they'll be able to talk to you about the various plans that exist, who providers of plans are. Again, the plan that I'm currently under contract with is called FIDA Care Complete. And it is a plan, the company is Centers Plan for Healthy Living, but the plan name is FIDA Care Complete. So they'll talk to you about the different plans, and the question that we've been waiting for is, how do I enroll? And that's going to end what we need to see on the computer. But under how do I enroll, New York Medicaid Choice is New York State's enrollment broker for the FIDA program. So you can enroll in any FIDA program by calling New York Medicaid Choice. Remember, that's the last number I gathered, and I'm going to put it on the screen, of course. From 8:30 a.m. to 8 p.m. Monday through Friday, New York Medicaid Choice. You can contact them, and they'll tell you about the different plans that exist, and be able to counsel you on how the program works for any additional questions you may have. So they provide free counseling about the FIDA plan options. They can help you enroll or disenroll, because once you're in the FIDA plan, you're not locked in. You can decide, okay, well, I don't like this, and you can disenroll. So it's not something that locks you in. One of the things that I like about it, I do get medication. I do, I'm prescribed meds. So, but one of the things that I really appreciate about the FIDA plan is there are absolutely no co-pays. Because even with my Medicaid and my Medicare, I can go get certain medication and they say, okay, well, your copay is this much or your copay is that much. It's like, are you serious? It's bad enough. I'm an insulin-dependent diabetic. Unfortunately, I don't have to take insulin anymore because I control my diabetes with diet and exercise. And that's a part of my wellness program. I want to be healthy. I don't have to stick myself with needles. But at the same time, I still need to buy supplies. Like my testing strips are the most expensive thing for me. And then testing throughout the course of each day, just to make sure that my blood sugars are on target, becomes kind of costly on a fixed income, which I really am. I'm singing, but I'm not really making money yet, and even under contract here with the Centers Plan for Healthy Living. Actually, I'm under contract with United Healthcare, which is Optum Health, who are subcontracted, and I'm subcontracted to them. But I'm not making money with them either, because nobody's enrolled yet. So we've got to get you guys enrolled so that you can get the services. For too long, I've been providing the services for free because I've never turned anyone away who wants peer support or bridger services from me. I know that I've been given a gift to be able to do this. to be able to have developed a system of being able to do non-clinical SOAP notes, which is very, very essential in being able to bill Medicaid directly and being a pioneer in this field. I don't take that lightly. A lot of people have not had a lot of the advantages that I have and that others have, and they need somebody that believes in them and that can help them make their dreams come true. And that's one of the main things that recovery coaching is about, and Recovery Coaching Service of New York definitely adheres to that principle. So anyway, to enroll in FIDA Care Complete, please call New York Medicaid Choice, and the phone number Monday through Friday, 8:30 a.m. to 8 p.m. All right, or you can visit the website. What we're going to do is call. So let's call New York Medicaid Choice. And let's see. Now, remember, I told you, I do not qualify, and I know I don't, but I want you to see the process. Now, you're going to need your Social Security card or your Medicaid card when you do this, because they're going to want the number, okay? So you're going to want to have that. You know your name, your address, your birth date. They're going to ask you that information. But what you may not have on hand that they're going to ask you for, and I'm telling you ahead of time, so that when you make the call, you've got your Medicaid card, your Medicaid number, or your Social Security number ready to give them, because they'll look you up. As a Medicaid, Medicare recipient, of course, the state has you on a list, and they can tell you at that point if you qualify or not based on the state's, your medical records that the state is looking at based on Medicaid and Medicare records at this point in your life. So we're calling New York Medicaid Choice to enroll in FIDA, 855-600-3432. And remember to dial a 1 first if you're dialing from a landline, okay? So we're calling, we're going to put them on speakerphone, and you guys be quiet. I don't want them to know you're there.
Thank you for calling FIDA, the fully integrated Duals Advantage program. Annuity, press 1. Para continuar, to better assist you, we need your Medicaid ID or Social Security number. To enter your Medicaid ID, press 1. Do not please enter your 8-digit Medicaid ID. To enter letters, please enter the numbers that correspond to the letters on your telephone pad. For example, thank you. To confirm your identity, please enter your number. Digit 6, 4 digits. The date of birth, 8 digits. For example, for enter.
Okay, so
Date of birth.
okay, so I entered the Medicaid number. They're still going to ask for it, even though I input it on the keypad. The person's going to show up, and they're going to still ask me to say it to them. So don't put the card away immediately.
Hi, my name is Bob. Can I have your number or your number?
Hi, my name is Lucius Conway. You're on speakerphone because I need both of my other hands. My Medicaid ID is Y as in yes, R as in Ralph, 26114, Z as in zebra.
Do you give me verbal consent to proceed with this call on a speakerphone?
I'm sorry, say it again.
Do you give me verbal consent to proceed with this call on speakerphone?
Yes, I'm very okay with us continuing with the call on speakerphone.
You say that you're not able to speak at this time, correct?
Say that again.
Right. You say earlier that you are not able to hold the speakerphone at this time. Is that correct?
I said that I needed both of my hands. I wanted to have this call, but I needed both of my hands free.
Okay. Can I have your name again?
What do you need?
Your name.
My name is Lucius Conway.
And are you calling for yourself today?
I am calling for myself today.
Okay. And can you verify your mail address, please?
My mailing address is 201 West 122 Street, number 504, New York, New York 10027.
Correct me if I'm wrong. You said 201 Street, number 501, New York, 1007.
I said 504, as in the number after 3 and before 5. 504.
Okay, so 201 West 122nd Street, number 504, correct?
Okay, you are saying 201?
Yes.
Yes, then that's correct.
Okay. Give me one moment.
Of course. You know your address, don't you?
And I also have your date.
My date of birth is 01/17/1963.
And what is the best phone number?
My phone number is 718-514-4560.
Do you have an email that you would like to ask today?
Sure, my email is luciusinnewyork@gmail.com.
You said Lucius at New York at gmail.com.
Lucius in New York. Everything's completely spelled out. Luciusinnewyork. Lucius in New York @gmail.com.
Okay, so this is the spell that I have entered it correctly. It is Luciusinnewyork correct?
That's correct.
Thank you. How can I help you today?
Okay, I want to enroll in FIDA. I want to enroll in the FIDA Care Complete plan.
Give me one moment, okay?
Of course. Less than 5 minutes, right? Less than 5 minutes to enroll.
Okay, have you gone to schedule for enrollment process? Are you familiar with the FIDA program itself?
I'm somewhat familiar. Is there information you'd like to share with me about the program?
Okay, so all the over some information to make sure you understand what it is at the moment.
Well, I know that it's the Medicaid Medicare plan, and the idea is to allow me to have benefits from both of those programs under one umbrella.
Correct. And aside from the different medicine, and each have their special and the others. So, I'm doors also the check the medical off with their okay?
I'm sorry, you were breaking up a whole lot, and so I don't think I got the majority of what you were saying to me.
Okay. Is there any way to close speakerphone right now? Because I can hear my phone coming from mine as well.
Let me see.
Okay.
Okay, let's try this. Okay, go slower, go slower. Each, other than the FIDA Care Complete plan, there are other plans. Each plan has their own providers in their own network. And what else? Okay, and then so after you enroll me, you can go ahead and check to see if my doctor and my pharmacy and all of those are in that plan. Is that what you? Okay, so you're saying you can help me check to make sure that those people are in before I enroll in that particular plan. And if not, can you find out what plan they are in? Okay, so you can find out if they're already in the plan I want, or you can find out what plan they're in. What about if I want this plan because it offers a service, a specific service that I know the other plans don't offer? Can I get my doctor and my pharmacy and the other people that provide services to me into this plan? Okay, so then if my providers are not already in this plan, they can make a choice to opt into the plan. I see, okay. Okay. English is my preferred spoken language. In terms of what language? Oh, written language. Yes, English would still, it would be my preferred spoken and written language, yes. Okay. No, I do not need information provided in Braille. And thank you, first of all, for apologizing for the redundancy of some questions you're about to ask me now. That way I'm less likely to become irritated. Okay, but no, I don't need any information in Braille. No, I do not need a sign language interpreter. No, I do not need information sent to me in larger text. But that's nice that you would do that if I needed that, yeah. Great, yes. Sure, my contact phone number again is 718-514-4560. No, I do not use TTY services. I will confirm my address for you once more. It's 201 West 122 Street, number 504, New York, New York, 10027. My date of birth again is 01/17/1963. No, it's not. It's Lucius, not Ludacris. Ludacris is a rapper. It's okay. It's Lucius, Lucious, kind of like Luscious, but Lucius, yeah. Okay, you're saying Medicaid does not have my current up-to-date address? Well, I don't know why, because I provided them with that 2 years ago. So I mean, perhaps somebody's slow in the bureaucracy. Yes, you'd like to give me a phone number so I can contact them. Now, this is what's irritating to me. I provided this information with them 2 years ago, and now you're telling me, oh, they don't have the correct information. But I get mail from them here, so I don't know why it's not updated on your side. Apparently, somebody has it because they do send me mail here to this address. But give me the phone number. Mm-hmm. Yes. Okay. Mm-hmm. Okay. Right. I'm sorry. That's right. I have straight Medicaid as well as Medicare coverage. I want long-term care services. Okay, wait a minute. Let's go slow. Home health aid, transportation. Okay. Uh-huh. Okay. Okay, wait a minute. Let me make sure I got a list, the list right. The long-term care would be for a home health aide, transportation to and from medical appointments, a personal care person to do cooking, cleaning, grocery shopping, and personal emergency response system. Right? Okay, I'm pretty sure I qualified for those services. Mm-hmm. Okay, wait a minute. You're going too fast for me. Okay, because I'm not currently enrolled in a managed long-term care program, then you would have to transfer me to another department called conflict what? Okay, conflict-free enrollment and evaluation center, because the enrollment isn't mandatory. Okay. All right, and then they'll send a nurse out to do an assessment. Okay. Mm-hmm. Very good. Okay. All right, but I don't want you to transfer me to conflict-free enrollment right now, because I need to do some other stuff first, and then I'll call back. But I'll call back. Huh? Okay, yes, please. Okay. Yes. Okay, great. Thank you so much. I don't. You've been an angel. Thank you so much. Well, no, I don't want to do a customer satisfaction survey right now, but I will next time. You too. Bye-bye. Okay, so there you have it. That's the process. And I did write down the conflict-free enrollment phone number, and I'll put that up as well. So the process is, if you're currently enrolled in a managed long-term care program, and the identifying provisions of that program are, you have a home health aide, or want one, you get medical transportation to and from, you qualify for personal care, whether you're getting it or not, in terms of someone to cook and clean and grocery shop for you, those kind of things, and you qualify for a personal emergency response system. So that's an alarm of some kind. I don't know if it's something that, you know, I've fallen, I can't get up kind of buzzer, or an alarm system in your home, something like that. So those are the qualifying indicators when we talk about, I guess, the nursing home and all of that stuff, because people who would require that may actually qualify for nursing home care. Anyway, that's pretty cool. So if you're currently enrolled in a managed long-term care program, so if you're getting medical transportation services, if you currently have a home health aide, if you get personal care services, if you have the PERS, or the Personal Emergency Response System, then you more likely than not qualify for FIDA, which means you can enroll in the FIDA Care Complete plan, which is where RCS provides peer support and bridger services, and you can avail yourselves of those. If not, as she explained to me, I could call, and I'll put the number on the screen, for conflict-free enrollment and evaluation. If you are not receiving those long-term care type programs and would like to, you can get them through the FIDA program. So home health aides, transportation, personal care, personal emergency response system, in addition to other provider services like recovery coaching services, peer support and bridger services, to help develop your own person-centered wellness and recovery plan. Conflict-free enrollment and evaluation. I'll put the number on the screen, and you call that number if you're not currently enrolled in a managed long-term care program. They'll take information from you. They'll send a nurse out to do an evaluation and assessment to determine if you qualify for long-term care. If you qualify for long-term care, which would be those kinds of programs we just mentioned, or the services we just mentioned, home health aides, transportation assistance, personal care assistance, and personal emergency response system. If you pass that assessment in terms of that, then of course you'll qualify for managed long-term care, and that of course will put you in a position to be able to enroll in the FIDA Care Complete plan. Actually, any FIDA plan, Medicaid, Medicare plan, but there's only one in the state of New York that has recovery coaching services, and as far as I know, peer support services and bridger services, and that plan would be FIDA Care Complete. So do call the numbers, enroll, and hopefully I'll see you in person very soon. This is Lucius Conway from Recovery Coaching Services of New York, wishing you and yours your best life.